ever stop to think about the true impact of smoking on your health? It's not just the smoker who suffers, but also everyone around them. In conjunction with the World No Tobacco Day, we'll be exploring the significant dangers smoking poses to both the smoker and to those exposed to the secondhand smoke. Stick with us for an eye-opening discussion on a topic that affects millions. Welcome back to another episode of Gleneagles Healthcast. I'm your host Nisa Hadira, and today we'll be looking into how smoking affects both smokers and non-smokers and what we can do to protect our health. Joining me today is Dr. Ong Choo Khoon, chest physician and respiratory expert from Gleneagles Hospital Penang. Doctor, welcome to the show. How are you?
Yeah, I'm fine, thank you. It's my pleasure to be here, and thanks for having me here to discuss on the health risks related to smoking. Yeah.
I see. I think really the World No Tobacco Day is something that we need to look into and really embrace and see the changes that we can make and to talk more about it. Yeah, Dr. Ong, as mentioned earlier, the World No Tobacco Day is celebrated on 31st of May every year. Why is this day so important in the fight against smoking?
Well, the World No Tobacco Day is a global reminder to every one of us, regarding the risk, health risk associated with smoking. It is not just the raising the awareness, but also to push people to go for action. We try to get people to quit smoking, trying to create a smoke-free environment, and also to encourage people to support the policy that actually aims to create the smoke-free environment and healthier environment for all of us, including our future generation, right?
I see. Well, I guess in that case, everyone plays a role as well.
Yes, you're right.
I see. I think it's very important to acknowledge this day. So, doctor, we knew that smoking is something that harms your health. But what exactly is going on in your body when you smoke?
Okay. Smoking basically can actually affect all the organs of the body, not just the lung, It is linked to increased risk of disease like the lung disease, heart disease, and what we call cerebral vascular disease like stroke. Smoker can also have increased risk of other diseases like gastritis, because it can also cause premature aging, to name a few, and also things like infertility. People thought, smoking will just affect the lung, but it's just beyond lung. And this is the main message that we want.
But that sounds like quite a number of diseases actually.
Yes.
We'll continue with another question. How does smoking specifically affect the lungs, since we always hear about lung cancer and chronic respiratory diseases?
Okay, the effect of the smoking is actually the chemicals that one inhale. What is actually inside a cigarette? It contains more than 7,000 chemicals that can actually harm the body. Okay, just to talk about lung, it affects the airway, the air sacs, and then it destroys the normal structures of the lung. Therefore, it leads to diseases like what we commonly see, like chronic obstructive pulmonary disease, chronic bronchitis, and emphysema. So these are the smoking-related lung disease. Of course, you're right. We also have a effect other than lung. So it is just beyond lung. So when we look at the smoking-related disease nowadays, we're not just looking at lung. People with smoking, for example, COPD. We're not just only treating their lung-related problem, but we also look at screening their risk of other diseases. The very important one would be cardiovascular disease, cerebral vascular disease, cancer that you already mentioned just now, but lung cancer, and also things like osteoporosis, premature, weakening of the bone, and immune system weakening, because they are also at risk of infection. That's very common among the smokers. Yeah.
Wow, doctor. I think it actually sounds like smoking accelerates the aging process in the body, especially in the lungs. Are there any other organs affected by smoking that people that did not even realize?
Like what I mentioned earlier on, people used to relate smoking with lung diseases or just airway problem, but it is just more than just lung. So organs that are commonly affected are like our heart, okay, cerebrovascular system. It affects the vessels. It causes narrowing of the vessels. It increases inflammation. So what are the things that we see in the lung, that happens in the lung because of the cigarette smoking? It causes inflammation, but you also see this inflammation in the vessels. So people with actually smoking related diseases like COPD, they are at increased risk of heart disease. So I think this is the message that we like to, bring through, to the public, that smoking isn't just affect the lung. People would think that, this is just as simple as, a cough, but it is just more than that. The effect is actually quite profound.
Right.
Yeah.
Then it's pretty clear that it's not only respiratory, but actually affects
Yes, correct. You're right.
Now let's talk about secondhand smoke. Many people think they are safe as long as they don't smoke themselves, but secondhand smoke is just as dangerous as smoking itself. Well, doctor, I'd like to ask a question. What exactly is secondhand smoke?
Well, okay, if you're not a smoker, but if you're exposed to smoking, the smokers, people around you who are actually smokes, you get the smokes, from the exhale and whatever that the smokers has bring about, that is called secondhand smokes. Okay, so actually secondhand smoke is also equally dangerous, as the smoke itself. Yeah. So if the people are exposed to secondhand smoke, the health risk is exactly the same like the smokers. It can actually affect the non-smokers' health, the health general, and it can also cause increased risk of respiratory diseases and other things that we have mentioned earlier on.
I see. I think that's really scary to think about.
Yeah.
So because we often think that people who smoke have a higher risk, but actually secondhand smoke has similar risk.
Yes, correct.
So let's go to the next question. Even if you're not the one smoking, you're still at risk, right?
Yes, you're at risk. That's why I think it is one of the important things. We do see a lot of respiratory cases nowadays. Some of them are non-smokers. Just to share, like things like lung cancer. Besides smoking history, one very important risk factors that we try to elicit from the history is like whether they are exposed to secondhand smoke or whether they have any occupational exposure. So these are things. So it's clearly, it's well established that secondhand smoke does carry a higher risk of health-related issue, especially, just the same like smokers.
I see. So I guess it is still the same risk.
Yes.
Let's focus on children for a moment. How does secondhand smoke affect them?
Yeah, as we know, children are what we call a vulnerable group. If they are exposed to adults who smoke, the children itself, the kids itself, will actually get the direct impact from the smoking, from the cigarette smoke. So children who are exposed to secondhand smoke, they are at increased risk, of lung-related problems. So they are more prone to get things like bronchitis, wheezing bronchitis, pneumonia, and sometimes like the younger children, like infant, there are actually studies to show that there is increased risk of sudden infant death syndrome associated with exposure to smoking. Yeah. So these are the effects that secondhand smoke can do to the children, the vulnerable group.
I see.
Right.
It sounds like it affects children as heavily as
Yes, correct.
adults.
You're right.
Well, that's quite concerning even for parents actually. Yeah. But I'd like to ask, what about pregnant women? How does secondhand smoke impact them?
I think it does the same for pregnant lady. Okay. The other important things that we talk about pregnant women, which is also, we consider them as a vulnerable group because they carry a baby. So if they're exposed to secondhand smoke, they're not only affecting the mother directly, but it also affects the baby in the wombs. Okay, they can have problems like a low birth weight, premature delivery sometimes, or any obstetric-related complication. So. And not only that, the effect may also, extend, after the baby come out from the womb. So I think this is a very important message. These are the things that we always tell the smokers when we try to get them to stop smoking. We're not trying to convince them, what is the importance to quit smoking, but we're also trying, the other way to talk to them about, what are the effects to their loved one. If you don't want your child, if you don't want your wife or family members to get sick, I think this is a very strong point, to really get the smoker to stop smoking.
I see. I think it really goes back to awareness as well.
That's correct.
Now that we know the risks that it imposes on pregnant women and other vulnerable groups, even on those exposed to secondhand smoke, let's talk about how we can prevent the harm caused by smoking and the secondhand smoke. What can people do to reduce this risk?
Okay, I think it's very clear for a smoker. The most important thing is to get them to quit smoking. The moment you quit smoking, or even to reduce the smoking, I must say that the smoking cessation is not as easy as what we see. Sometimes I look at it differently. Some patients, not all of them have the same journey, in the journey of them to quit smoking. So if they can't quit immediately, at least, we should actually advise them to reduce the risk of smoking. Once you reduce or you quit smoking, it will actually definitely, be beneficial to the smokers. For those people around you, we talk about secondhand smoke effect. So I think one way to reduce the risk is to create the smoke-free environment. The smokers, if they can, they try not to smoke, at home. The public or even the policymaker, these are the effort that we're trying to do to create more smoke-free environment. So these are the way to directly, reduce the risk of smoking.
I see. Doctor, what about those who are not ready to quit yet? Are there other steps that they can take to reduce the harm caused by smoking itself?
Like I said, the quit smoking is a process. First of all, when one already smoked for many years, I think sometimes it can be quite hard for them to stop immediately because of the nicotine dependence. So there are ways to help the smoker to stop smoking. We have nicotine replacement therapies like patches, the gums, or even non-nicotine replacement therapy in the forms of pharmacological treatment. We have tablets to help the smoker to stop smoking. But what I think is important is the will to stop smoking. So when we see patients like this, that at least they have the wish to the will to stop smoking, and they can actually get help, from the healthcare provider. We have things like Clinic Berhenti Morocco. This is actually readily available in the healthcare facilities like in the government MOH, and the help is there. It's just that, how to get them to have access to all these things. Yeah.
Well, what about people who live with smokers or work in places where smoking is allowed? How can they protect themselves?
Okay, well, I think this involves not only a party. Okay, I think everyone plays a role. I think the awareness is very important. Once we know that, the risk of smoking and the readiness of the public, in order to play their role to actually create the smoke-free environment, I think all it is, we can actually help to reduce the risk. Okay, if you're actually working in a place, studying in a school or any places, okay, what you could do is the policymakers or the person in charge, trying to implement smoke-free policies. Okay, that is for the non-smoker. But for smokers, like I said, it's not as easy as, to quit smoking for some of the smokers. But how do we get these things solved? I know this is not the final solution, but at least, you create a place where they can actually get away from the non-smoker. You have a smoking room or something like that. It is at least in an effort, and an attempt to actually reduce the exposure of this cigarette smoking to the non-smoker. Yeah.
Well, are there any support systems for people who want to quit smoking? I know that it can be quite a challenging process for them.
Yes, I agree that it's not easy to get a smoker to stop smoking. Everyone plays a role. If you talk about quitting smoking, how do you get a person to stop smoking if they have the wish to do so? There are ways, like what I mentioned early on. We have some ways to help the smoker to quit. Counseling, okay? A lot of time they need support, not only from the families, also from those who are actually experts in handling, the smokers and get them to stop smoking. We can have, these are what we call non-pharmacological, so you have counseling, you have this support group and etc. The sharing, like what we are doing now, a World No Tobacco Day, we have all these things. This is also, part and parcel of the effort, or the our effort to actually implement this, the importance of stop smoking. The pharmacological treatment, like strategies like we have nicotine replacement therapy or non-nicotine replacement therapy. These are the pharmacological way of helping the smokers to quit smoking, right?
Thank you, Doctor, for such a detailed and insightful discussion. It's pretty clear that smoking and secondhand smoke are a serious health risk, but there are steps that we can take to protect ourselves and also our loved ones. Doctor, thank you so much for joining.
My pleasure. Thank you.
Thank you for your so much explanation, and I think it's really clear. And to everyone listening, remember that the best way to protect your health is by quitting smoking. But if that's not possible yet, creating a smoke-free environment is key. Support is also available for anyone looking to quit, and making small changes can actually make a huge difference in your health.
Right.
Well, now, as promised, here are the winners from last week's giveaway quiz. DM us if you see your name on the screen to claim your prize. Congratulations to the winners. And if you didn't win this time around, there's always the next one. And pretty sure to look out for our next healthcast. And therefore, we have reached the end of our episode. If you found today's episode helpful, make sure to follow, like, and share this with your friends and family. Let's spread awareness and work together to protect our health from the dangers of smoking and secondhand smoke. Stay healthy and thanks for tuning in. Bye!
Bye-bye.